right.
Okay, so then
Yay.
everybody out there in the healthcare supply chain world can hear us talking as Anita gets started here in her presentation. And well, I love to have these recorded for everybody. And so welcome, Anita Zado. Appreciate you.
Thanks, Angelique. Can you hear me okay?
Yeah, you sound great.
Perfect. All right. Sounds great. So, hey, good afternoon, good evening, everybody. I'm super excited to be here and thrilled to be on this learning bite tonight. So, as Angelique said, my name is Anita Zado. I'm the clinical VP of Clinical Services at Capstone Health Alliance, which is a regional GPO. I also have a nursing background and hold a certification in value analysis with the CVAP or with AVAP. So I'm super excited to be here, and I really want to thank Angelique for inviting me to lead this learning bite. Really hoping to explore some practical strategies for building stronger relationships between value analysis and supply chain. So I want to start by saying the simple truth really here is all about partnerships between supply chain and value analysis. These are not just nice to have relationships, they are essential. So when these two teams work in alignment, we make stronger decisions that balance both clinical and financial priorities. And ultimately, we achieve better outcomes for our patients and the health system. So this relationship is the one good thing that COVID did to improve healthcare a few years ago. Nobody can forget COVID. So our goals today are really straightforward. So first, we're going to explore the strategies that help build trust, communication, and alignment. And then I'm also going to share some practical takeaways that you can bring back to your teams and your facilities and apply immediately. So here's what you should leave with from this session, hopefully. So one is a framework for aligning supply chain and the value analysis priorities. So both teams really work toward common success metrics. We're going to learn about strategies for trust building and communication, really that help avoid those silos that are all throughout our facilities and improve collaboration. We're going to talk about the tools to respect and leverage each team's really unique expertise, whether that's clinical insight or contracting know-how. Talk about the best practices for early and consistent collaboration. So the conversations will really start before decisions are locked in. And finally, a mindset shift, because this partnership really can't be a one-time project. It should become part of your culture, something that you really practice every day. And if we accomplish that in this 30 minutes today, then this session will have been a success. So go ahead and go to the next slide, Angelique.
I love it. All right.
So I want to take a minute to talk about the challenges that both groups face today. Probably nothing that you guys are not aware of or haven't heard before, but the priorities often feel misaligned. So supply chains usually laser focused on cost savings, while value analysis is focused on clinical outcomes and safety, which is the way it should be. So a lot of times it can feel like we're speaking two different languages. And that is really what makes one side is like negotiating with spreadsheets, and the other side's like negotiating with surgeons. So, interestingly enough, I led a value analysis panel a few weeks ago, and most of the audience there was supply chain and suppliers. Good mix. So at the beginning of it, we started with a word cloud. I'm not sure who's familiar with a word cloud, but you go in, it's an app, and you put in what word we asked the audience to put in what word would describe value analysis for them. So the most common words that came back from that group were clinical blockers. And to me, when you ask the supply chain group what that means versus asking a clinician group, you're going to get two different answers. So I was a little surprised that clinical blockers came out. So we have to correct that mindset. So improving the communication between these groups is imperative. Sometimes supply chain hears about a product change only after it's already in the OR, and value analysis gets pulled into a decision only after the contract is signed. That's when the frustration kicks in and the project stall. We all felt, the pressures from standardization, contracting complexity, and even sustainability requirements lately. So these pressures are not going away. And I think if anything, they're going to continue to ramp up. So to put it in everyday terms, I would describe supply chain and value analysis. They're a little like peanut butter and jelly. Alone, each of them is fine. But together, when they actually talk and work in sync, you get a yummy sandwich. So if you try to do one without the other, well, you're just going to have either a sticky mess or dry bread. So the truth is, while our perspectives may differ, both are absolutely vital. Without supply chain, we can't make things affordable and sustainable. And without value analysis, we can't make sure the patients are safe and clinically sound. So the healthcare system really needs both together to succeed. Go ahead, Angelique. So I want to emphasize here how shared goals can really create that alignment. One of the most powerful ways to bring supply chain and value analysis together is by establishing shared goals. Too often, these teams operate with different scorecards. Supply chains measured on cost savings and contracting efficiency, while value analysis is focused on clinical outcomes and patient safety. Again, absolutely the way it should be. When those metrics don't line up, it feels like we're rowing in opposite directions. But when we align really around the quadruple aim, which is around costs and quality, patient outcomes, and staff satisfaction, the conversation and the game completely changes. Both perspectives matter and they reinforce each other. So here's an example. So let's just say that OR is evaluating two different suture products. We'll call supply chain sees that product A, which is what we'll call it, is significantly cheaper, while value analysis highlights that product B, Johnson & Johnson, reduces wound complications. Instead of arguing over which matters more, let's develop a shared goal. That shared goal could be to reduce total surgical costs while improving patient recovery. When you frame it this way, both teams can support choosing product B as long as the data shows fewer readmissions and lower overall cost of care, even if the unit price is higher. So practical tools like shared scorecards or dashboards really make this even easier. So imagine seeing clinical impact and financial impact side by side. That visibility keeps everyone accountable and moves the conversation really from compromising to integration. So the bottom line here is shared goals really transform the dynamic from more of an us versus them into one team, one mission. Go ahead and go to the next slide.
That's awesome. Hey, real quick, Anita, are you guys doing like okay, so you guys voted yes on something because of these different metrics. Are you guys doing like a 6-month or a 1-year look back to say, hey, did we actually achieve those metrics that we kind of agreed on as a team?
Yeah, we're actually doing it quarterly. We do quarterly tracking. So, but yes, we do that for sure.
I love that. Okay,
Yeah.
very cool. All right.
Yeah.
Oops, next slide.
And that's yeah, and that's also included in our like supplier scorecards, those metrics as well. So we keep up with that.
Oh, very, very good. Okay.
Yep. Yep. So as far as building trust, this partnership really grows again through trust. And we all know from being in relationships that trust doesn't happen by accident. It's built over time. through consistent and open communication. One of the most common challenges I hear is that either supply chain or value analysis feels like they're being brought into the process way too late. By the time one team's asked to weigh in, the other has already made progress, and it feels like there's an uphill battle to catch up. So that's where the frustration comes in, the misunderstandings, and that can sometimes damage the relationships between supply chain and value analysis. So the best way that we've found is to prevent this is really early and ongoing engagement. Bring both groups into the conversations at the start of the product evaluations or the start of the contract reviews, whatever you're looking at. And really, when we're aligned from the beginning, we not only avoid those surprises that happen, but we also show respect for each other's expertise. So, it really means a lot. And in today's world, you see a lot more clinicians within the supply chain world. And again, that's what COVID did to help the supply chain today. So I would imagine, you know, let's just say supply chains negotiating a new contract on surgical gloves, but value analysis is really only pulled in after the pricing is finalized. The clinicians are probably going to say, they're probably going to push back at that point, saying those gloves didn't meet quality or performance needs because they weren't involved in the beginning. All of a sudden that really makes the savings disappear because the contract will need to be renegotiated. If both of those teams had been involved from the start, the right product and the right price could have been secured without all that wasted effort. I see good partnerships. They're kind of like Wi-Fi. You don't notice it when it's working, but you sure do when it drops. So, you we all are aware of that. So I think the big takeaway here is pretty simple. Trust grows when we keep each other in the loop. Early engagement builds confidence. Ongoing engagement sustains it, and together we really get better results.
Anita, I get questions all the time. Do I have to have a nurse title to work in value analysis? And would clinicians still listen to me if I didn't? What are your thoughts about that, real quick?
Yeah, no, that's a great point. So you don't have to have it, no, because I've worked with some people in value analysis that never had any, never went to nursing school, but they've learned it by trade. So even better than some of the nurses. But unfortunately, there is that stigma that nurses do like to talk to other clinicians. But I think building that trust if you don't have that clinical background, building that trust is even more important with a non-clinician to a clinician. So it can be done both ways.
That makes a lot of sense. So, hey, for those of you out there who are discouraged by your title, don't be. Okay.
No,
I love it.
definitely
Okay.
not. Like I said, I've worked with some people who did not go to nursing school or anything, and their elevators went higher than other people.
I love it. So we got to have a good personality, though. I was saying the other day on my last learning bite that you have to have thick skin to be in strategic sourcing and contracting, because this is not for the faint of heart. Because you have to have a personality and you have to be able to
That's
talk to people. So I love it.
that is for sure. That is for sure. Um, so as far as the leveraging the strength, one of the best parts of this partnership is really that value analysis and supply chain bring different but complementary strengths. So back to your point about not having a clinical background versus having a clinical background. So they both they both complement each other. You can't have it if you don't have the total package because you have to know about supply chain, you have to know about value analysis. Value analysis is really the bridge to the clinical expertise. That brings in the data piece, the frontline feedback, and the evidence about whether a product truly supports patient safety and outcomes. Supply chain really, on the other hand, brings the contracting expertise, the market knowledge, and the ability to secure the best pricing and terms. I mean, I'm a nurse, and I've learned, from my contracting team now that I want to do more nursing stuff and let them handle the contracting piece because that part of it is just not as fun to me. But we both work together to accomplish the same goals, and the suppliers really respect that. Um, so another example I can think of here is really when, let's just say, value analysis says they're working on a new infusion pump, and they found one that really meets all the safety standards, has the positive clinician feedback. Then supply chain will go and leverage to negotiate the supplier training, the service coverage, the bulk pricing if needed. And really, they're working to ensure that that deal isn't just clinically sound, but it's financially sustainable too. So that's how those two teams would really work together. So again, if I can't emphasize it more, neither group can succeed in isolation. The value analysis without supply chain, it really risks overspending. Supply chain without value analysis risk choosing the products that clinicians will not adopt no matter what you do. Unfortunately, we're stubborn. I can say that because I am a clinician. We're stubborn. Um, but together we really balance those clinical needs and the financial stewardship, and that's where the real value lies.
Yeah, and for those
Um,
of you guys who are taking my certification in strategic sourcing and contracting, I go through the 7-step strategic sourcing process, which is really just supply chain 101. But from a healthcare standpoint, healthcare supply chain, I talk about those two teams being duct taped together. You cannot work an
yes.
initiative, strategic sourcing and contracting, without clinical value analysis, and vice versa. Like they have to be duct tape together. So within my teams where I work today, I'm constantly doing what I call a service line team meeting, meaning value analysis team members with strategic sourcing and contracting, even with the buyers, even with the service line analyst. And they do that once a month because if you guys aren't all talking, there's a problem there. You guys all should be duct taped together. So that's amazing, Anita. Thank you for reminding us that.
Yeah. I mean that the contracting piece is it's kind of like a marriage. It's called my work wife or my work husband because you're spending more time with them, as you are at home, and you have to be like a marriage counselor. You have to find the products that the doctors like and will actually use, and then the pricing that makes the financial officers, the CFOs, happy. So it's a fine balance for sure.
Yeah. Okay, that's awesome.
Yeah. So I think to summarize, there's really five big takeaways for the conversation today. So one, shared goals really unite the priorities. So when supply chain and value analysis agree on what success looks like, it stops being a tug of war and starts becoming more of a joint climb up the same mountain. Second, the communication builds trust. And remember, surprises are fun for birthdays, but not for contract reviews. Never fun surprises. So keep each other in the loop and you'll avoid a lot of frustration. Third, each team really brings unique strengths. Value analysis brings clinical expertise and evidence. Supply chain brings contracting power and logistics know-how. So put them together and you got the healthcare version of a superhero team up. I'll say Batman and Robin, except in scrubs and spreadsheets. Um, Fourth, I will say early engagement prevents delays. The later one team is pulled in, the harder it is to make changes without a wasted effort. So think of it like cooking. If you forget to add the main ingredient until the end, that dish is ruined. So involve both teams from the very beginning. And then finally, a partnership is really an ongoing mindset. It's not something, it's not a one time project or a box to check. It's a habit, something you practice every single day. These are lessons I would say carry back into your daily work. And if you focus on these shared goals, the communication, strengths, early involvement, and mindset, you will not only make better decisions, but you'll also make the process a whole lot smoother and maybe even a little more enjoyable, hopefully.
I love it. I love it.
And then I have one more slide, Angelique.
One more slide. Okay.
So, and I know we're getting close to time, but I would say as we wrap up, I want to leave you really with one final thought. Partnership isn't, again, a one time project. You want to practice that every day. Um, every conversation, every evaluation, every negotiation is an opportunity to build that trust and alignment between supply chain and value analysis. Commit to that collaboration as part of your everyday culture, not when it's convenient, not when, this is your day to day work, day in and day out. So when you approach it that way, you'll see the difference. You'll start seeing smoother processes, better decisions, and ultimately stronger outcomes for the patients and your organization. And it'll go a lot smoother, during your negotiations. So I would say, here's my call to action. Take what we've discussed today, the strategies, the takeaways, the mindset shift, and put them into practice starting tomorrow. Those small, consistent steps will transform how your teams work together in your facilities. So I would say with that, I'll pause and, thank you guys for your attention. And I would open it up for any questions or any ideas, or even, if anybody has any other success stories they could talk about with their value analysis and supply chain collaboration.
Yeah. I know we've never done a Q&A session. Usually I'm just teaching. So look
Yeah.
at Anita's opening it up. This is your chance, team. Who's got any questions or suggestions or just thoughts overall of what she presented?
I don't
She's
know, but
amazing.
Angelique told me 30 minutes would go by fast, and it went by fast.
It did. It did. Oh my goodness. All right, Nurse Heidi, I
um,
know you got something to say about this.
I'm sure everybody's experienced this today because, again, COVID really brought out, there's so many nurses or clinicians in supply chain today. I mean, kudos to those who have experienced it.
Yeah. And I know Heidi wants to say something.
Yeah, I was just going to say, I think this conversation, being a clinician myself, is I loved all of the talking points. And I think you hit the nail on the head when you said, um, it really requires teamwork. And I feel like supply chain is engaging at the clinical levels better because they're engaging value analysis. And I love what you said is as nurses, we're stubborn. We're so tribal and we don't want to be told, we want to be included. And I think that you're spot on with saying we need to be duct taped together because we are stronger as a team as opposed to working as individuals, and especially individual departments.
Absolutely, completely agree.
I love that. I love that. And what I do in some of my certification programs is I encourage suppliers trying to figure out how to get their foot in the door because I always have suppliers on my call. Um, to reach out to strategic sourcing and contracting and value analysis together in an email, because strategic sourcing and contracting doesn't make the decision and they don't govern the decision-making process, right? So they want value analysis there in case they're hearing in a value analysis meeting that there's a complaint about something, or they're out rounding and they're speaking to a clinician and the clinician says, oh my gosh, this is driving me crazy, or this has caused me so many problems. The nurses and the folks on the value analysis teams are hearing the boots on the ground frontline stuff. So I always encourage suppliers, as you have contacts, contact both, or even ask the strategic sourcing and contracting person, hey, I'd love to include your value analysis person for this product category in the conversation. Can we bring them in? Because I feel like it's a more hearty conversation.
Yeah, I would agree. And even that panel I did a couple of weeks ago, the suppliers they just feel like we're shutting them out from a value analysis perspective, and we're not shutting them out. We're just trying to vet out the products to make sure, because we have what we need. We want the fluff. And sometimes I told them, I said, sometimes you're going to have to hear that you have an ugly baby, but at one point you're going to have a beautiful baby, and we need to know you until then.
Yes, yes. I love the analogy. I love it. Blair, were you going to say something?
Can you hear me?
Yes.
Oh, there's Blair. Hey, Blair.
Hey, Anita. How are you?
Hey.
Always good to hear from you.
You too.
So obviously I'm on the vendor side, right? And I've been on the GPO side as well. And one question I have for the team would be, how do we navigate value analysis when you're talking about different clinical levels of products, right? So if you're talking more commodity type products or low clinical, preference type items where the GPO has already gone through the process of vetting out the vendor, and then the value analysis team have so many categories, right? So many products they've got to review, so that you don't get stuck going through the full process for some of these lower clinical preference type items, right? It's like routine respiratory disposables and those types of items where we tend to get hung up, how long it takes to get even through the value analysis process. And I've seen some things where they've definitely ranked different categories so that, value analysis, I get that you change the color of an item, right? The clinical team has to be aware of that. But I see a lot of these large IDN systems getting really hung up with, I'm not sure the right terms, overanalyzing, but going through the full process for low clinical preference type items. Does that make sense?
Yeah. Oh, absolutely, Blair. Yeah. And you couldn't be more spot on. So one of the things that, and I'm sorry, Angelique, did you want me to take that, or do you want to take that?
No, keep going. You're awesome.
Sorry. No, one of the things that we've done at Premier as well as Capstone is we've started doing value analysis complexity scoring for each category, so that clinicians will be able to see at the contract launch, hey, is this a category that should be a no-brainer, that as long as the pricing is good, the products have been vetted, and you should not have to go through an entire value analysis process. So depending on what that scoring is to how they would rank it in their value analysis process. Now, is that going to change overnight? Absolutely not.
Right.
And is that going to change for each individual facility? No, it's going to take some time. But that is one thing that I think everybody should be doing, is scoring those contracts from a complexity basis. How much work it's going to take, how much time it's going to take for a conversion. Is it a standard cross-reference? Does it need a lot of support from the supplier in the field? Those types of things. And really, start to try to, I won't call it standardize the value analysis process, but really, eliminate it, or not eliminate it, but lower the time that it takes to do the entire process. And we've gotten our members to jump on board and start getting used to it. But again, that's just going to take some time.
Right. Okay, that's good to hear. I mean, because you're fully aware, right, of that pendulum price went way too far of overanalyzing everything, and then It's got to be the oversight, but like sometimes it's just paralysis through analysis, maybe. So
Yeah.
We feel the same way too, Blair.
yeah, okay,
Yeah.
awesome. Well, good to see you.
Yeah, and Blair, I'm going to give you one more suggestion because I do see a couple of my supplier friends on the call. So I am encouraging through my certification program that suppliers really do an assessment of each and every customer as far as their maturity state of their decision-making governance model. And the reason why I say that is exactly what Anita is saying. She at Capstone could be at this level of their decision making's dialed in. They have this complexity scorecard. You come to where I work at Legacy Health, same thing. You've got Angelique working here, so it's dialed in a bit differently than other health systems. And then you go to this other health system in your region, and they have no value analysis process, or they're not doing any scorecarding, or they have a completely different decision making model. So I'm really pushing and helping suppliers out there through my program create some kind of a customer assessment model so that you can really understand their entire decision making governance, where it goes through, who manages it, what is it, committees, what's the structure, and really understanding their maturity. And maybe some of them do have something like Anita's talking about, or some of them are like, I don't even know what you're talking about, so just pitch me your thing and maybe I can just get it approved. So you really have to decipher as a supplier each and every one of your customers, because they're 5,000 times different, customer to customer.
Yep.
Yeah. Awesome. Anita, you're incredible. So glad that you are here with us today.
Thank you very much.
Thank you for sharing your knowledge with us. I appreciate you. And so everybody on the call, I am going to send out Anita's PowerPoint deck, the recording, and her massive action checklist for tomorrow, because we want you implementing these great tips and tricks that we share every Tuesday and Thursday. And then I will see you guys all again next Tuesday for another amazing hot topic. And thank you so much, Anita. We appreciate
Thanks,
you.
Angelique.
Okay.
Have a good
Bye,
night.
everybody.
Bye.
Bye.